My name is Aaron Sinclair, and for my project, my target population, I decided to choose African American women and how diabetes can create a greater risk for COVID-19. So first, to start, what is diabetes? Diabetes occurs when blood glucose levels in your body are too high, and the hormone that is responsible for regulating blood sugar is called insulin. So anytime there's issues with insulin, whether you may have you're not making enough insulin or you're not making any insulin at all, that can cause your blood glucose to remain in your blood, which can lead to diabetes and other health problems. So there's some symptoms of diabetes. Some symptoms include fatigue, blurred vision, unexpected weight loss, and increased hunger, thirst, and urination. And then there's different types of diabetes. The three main types are type 1, type 2, and just gestational diabetes. And then here is an infographic of just some general statistics and just to show the effect that diabetes has worldwide. This is from the World Health Organization. So 422 million adults currently have diabetes, and 3.7 million deaths are due to diabetes and high blood glucose, and 1.5 million deaths are caused by diabetes. And then so if you do the math, that's one in every 11 people. And as I stated before, main types are type 1, type 2, and just gestational. And some consequences of diabetes, it can lead to stroke, blindness, heart attack, kidney failure, and amputation. And then this infographic just shows different ways to manage blood sugar, and it gives you a quick, brief understanding of how blood sugar works, how to test for it, and the different levels of blood sugar, and how to gauge if what happens if your blood sugar is too high, and the and what the ranges mean. And there's also some tips on how to help regulate your blood sugar. So, in regards to type 1 diabetes, this is an infographic explaining how type 1 diabetes works. And with type 1 diabetes, the pancreas um, does not make any insulin at all. And this type 1 diabetes is more of an autoimmune type of diabetes where your immune system attacks the pancreas and destroys cells that make insulin. So this is more of a genetic deficiency, autoimmune deficiency where your body is destroying the cells that help make insulin. So as a result, if you're not making any insulin, the blood glucose will stay in your blood, which will make your blood sugar stay very high, which can cause health problems. And then with this type of diabetes, type 1 diabetes, the pancreas cannot make insulin again because the body is always destroying the cells. So with this type of diabetes, you always need to make sure that you have your insulin readily available because that's something you're gonna have to take every day because your body cannot make insulin. Okay, and with type 2 diabetes, this is more um, this is more of the diabetes where this comes in when you're overweight or you're obese, so your body cannot use the insulin correctly, or your body fails to make enough insulin. So this is just explaining type 2 diabetes and some statistics saying more than 30 million adults in the US have diabetes, and about 1 in 4 adults with diabetes don't even know that they have it. And then here's just some symptoms: extreme thirst, feeling hungry, even while eating, frequent urination, slow healing cuts. And then this showing some of the dangers once again. High blood sugar can increase your risk of heart disease and heart failure. It can threaten your vision and limbs. And the different body parts that can be affected because of type 2 diabetes is the nervous system, your coronary arteries, kidneys, blood vessels, feet, and skin. And it's especially important with your kidneys because your kidneys help filter out your blood. So if you have an excess amount of blood glucose in your body, it would be hard for the kidneys to filter that out. And an overview of gestational diabetes occurs when a woman's body cannot make enough insulin during pregnancy. This condition can increase a woman's chance of having high blood pressure, and gestational diabetes can create the risk of a child being born early, large, having low blood sugar, and can also develop type 2 diabetes later on in life. So, this slide is explaining how diabetes affects African American women. 1 in 4 African American women over the age of 55 have diabetes, which is double that of white women. And obesity is a risk factor of diabetes that African American women have a higher rate than white women as well. And African Americans as a whole have higher rates when it comes to experiencing the serious complication of diabetes. So as I mentioned before, amputation, stroke, those complications are seen higher with African Americans than other groups. And then just to continue how the diabetes affects African American women, a risk factor of diabetes is lack of activity where African American women lack compared to white women. And from the age groups of 25 to 74, African American women are more overweight than white women. And this is explaining how diabetes is exacerbating, how diabetes perpetuates African American woman vulnerability to COVID-19. So diabetes is shown to create a greater risk to contract COVID-19 individuals. That's one of those underlying conditions that are explained that can cause individuals to be more susceptible to COVID-19. And then, as I said, especially in African American women, diabetes makes them more susceptible to COVID-19 than other demographics. And African American women already shown higher rates and risk factors compared to other groups. So, along with those risk factors of diabetes, since they already have a higher rate for those risk factors, COVID-19 would just make it um, even worse to have those risk factors because it will make them more susceptible to contracting the virus. And then gestational diabetes poses a great problem to African American women. African American women have the highest maternal mortality rates compared to other races. So just the fact that we see African American women who give birth are dying more frequently than other races is already an issue in itself. So having diabetes along with that, which can cause other health problems if not managed properly. So during pregnancy, African American women are subject to different stressors that can cause the immune system to weaken. So gestational diabetes can provide an additional challenge if not managed properly, can leave women more susceptible to contracting COVID-19 because with a compromised immune system and your body not being able to fight off using its natural defenses, it leaves more susceptibility for women to or African American women to contract COVID-19. And then here's just some infographics on the following slides, just to explaining how diabetes and COVID-19, how individuals can stay healthy, especially being diabetics during the COVID-19 pandemic. And it's more of the common things that's being said every day and by the news and by different health officials. But just some extra steps to take. Say if you are someone with diabetes, just make sure that you always have your extra medication and supplies. Because in the case of, say, if there's shutdowns occur again, you don't want to be in a situation where you don't have enough supplies and it's going to be very hard for you to get your insulin or your blood glucose strips to test for your blood sugar levels. And then there's another infographic, just 10 ways to prepare yourself and protect yourself. if you're 60 or have 60 and older or living with underlying conditions. It's the same general things that are being said in the news, but it's very important to know that these steps should be taken extra serious, especially at underlying condition that is already compromising your body. And this is explaining how your kidneys, diabetes is the number one cause of kidney failure, which is very serious. If it can be fatal if you have kidney failure. And well, you can live with one kidney, but if you have kidney failures in both of your kidneys, then obviously you can die. And like there's different ways that diabetes can damage your kidneys. As I mentioned earlier, too much glucose in the blood makes your kidneys work harder, and then this damages the tiny filters in your kidneys, and then this is irreversible. So once these are damaged, it cannot be repaired, and then your kidneys begin to leak protein into your urine instead of keeping it in your blood, and then the damage gets worse over time. So more fluid and waste stay in the blood instead of being filtered out into your urine. So if your diabetes is not managed properly, as I mentioned before, it would make your kidneys work harder, and then with your kidneys working harder, it would there would not become efficient, leaving waste in your body, which can damage your body. And these are just some of the references I used for the project. And my name is Aaron Sinclair again, and thank you for reading through and listening to this presentation.